Hi guys, Yolandi here from Vent Company, your ventilation specialist, and today we're going to have a look at the automatic suction routine on the Elisa ICU Ventilator from Lowenstein Medical. The automatic suction routine, or ASR function, is there to supply extra oxygen when you are suctioning a patient. The ASR can be accessed in your function submenu or via your shortcuts. You can choose between suctioning for an open or a closed system. If you choose an open system, there are 3 phases of 2 minutes each: pre-oxygenation, suctioning, and post-oxygenation. If you choose a closed system, you have 2 minutes of pre-oxygenation. You can also adjust how much additional oxygen you want to give to your patient. Our simulation patient is set on a FiO2 of 80%, and if we give an additional 20%, that results to 100%, and you will see that reflected on the screen.